Good morning, walking warriors, and how are you doing this morning? I hope this finds you doing okay. Now, is it just me, or I was watching over some of my past videos and I noticed that I sounded kind of nasally, and I'm hoping it's just me. But if you think that I sound nasally, could you please leave it in the comments below, and I'll see if I can figure out if it's the sound on my mic or something. Also, I want to go over a very important subject today of sleep apnea. Now, let me give you a disclaimer first. I am not a medical professional, nor can I diagnose or confirm a medical diagnosis. The only thing I can do is point out some things that you may want to check in with your primary care provider about, and that would be your first step, is going to your primary care provider. So today, like I said, we're talking about sleep apnea and risk factors, symptoms, treatment of care, and specialists that you can talk to. And I do have my trusty notes, so let's get started, shall we? Sleep apnea is a potentially serious sleep disorder which breathing starts and stops. Do you have a loved one, or do you yourself find yourself snoring in the middle of the night? And have you ever been woken up by a loved one and told that you stopped snoring for a couple minutes or up to a minute? This may be sleep apnea. Now, my husband has sleep apnea. I myself have sleep apnea, and our 12-year-old has sleep apnea. And we all have this sleeping disorder. Now, though my husband and my son can be treated, I can't be treated currently, so I sleep propped up in a semi-sitting position, because if you notice on my face, and I didn't wear makeup today just for this sole purpose, I have these little white lines right here, and I have a white spot right here. It's because I'm allergic to the CPAP mask. The masks are made of silicone, and I can't seem to find one that won't cause infections to break out on my face. The first time I became aware that I was allergic to silicone was when I was diagnosed the diaphragm to use as birth control. That was not a fun experience to figure out I was allergic to, by the way. So let's go over risk factors. Your age can be a risk factor. Now, this isn't always true. Like I said, our 12-year-old son was diagnosed with sleep apnea. So it can actually hit any age, whether it's children to adult. And when my son was seeing the sleep specialist, I asked him how many children are actually diagnosed with sleep apnea, and they said you'd be surprised how many children come in here and get diagnosed. Second risk factor is obesity. Now, this is my son's circumstance. My son is obese, and though we're trying to help him lose weight, it's causing problems because he's not getting a good night's sleep, so he's always tired. And currently, right now, his CPAP machine has been recalled, so he can't use his CPAP machine until his new one is sent to him. My husband is obese as well, and I was considered obese until I started losing weight. Though I'm not really on the obese scale anymore. My BMI is up there, but it's not morbidly obese like it used to be. And your sex. Men are more common to be diagnosed with sleep apnea than women are. And I'm not exactly sure why that is, but it's just the true risk factor. Being a male can be more detrimental when it comes to being diagnosed with sleep apnea. Symptoms include snoring loudly. My husband could literally blow the house ceiling off the house. I mean, his snore was so loud, it was amazing that I used to be able to sleep through it. tired even after a full night's sleep. Have you ever woken up and you're just exhausted even though you just slept a full 8 to 10 hours of sleep? This could be a risk factor. Excessive daytime sleepiness. Again, that goes along with being tired after a full night's sleep. Did you sleep a full night and you wake up the next day and you're just tired all day long and you feel like you need a nap? Do you take naps during the day and even wake up feeling like you hadn't slept at all? This can be a risk factor for sleep apnea. Insomnia. You ever have a hard time falling asleep? This is what insomnia is. It's a chronic condition in some people where they just can't sleep. Nightmares. Nightmares are horrible. Let me tell you, I have been having nightmares since I was a teenager, and I have night terrors to the point where I can't wake up out of them. And I've been having nightmares over the last couple weeks that have just shook me to the complete core of my being. No breathing. Have you ever stopped breathing while you were asleep? Do you wake up startling yourself because you wake up gasping for air? Breathing through your mouth. Are you a mouth breather when you sleep? For some reason, this is a symptom of sleep apnea. Now, I personally myself am a mouth breather. I've never been able to sleep through my nose, and I'm not exactly sure why, but it happens. Loud breathing. Do you breathe really loud when you're asleep? Like to the point where the person next to you has a hard time falling asleep because of how loud you're breathing? This is a risk factor. Depression. Depression can cause sleep apnea or is caused by sleep apnea. If you're not getting a full night's sleep, it can depress your mood. Dry mouth. You ever just have to wake up in the middle of the night and drink water because you've got so much dry mouth going on that you're having a hard time sleeping? I know I do. Fatigue. Do you wake up feeling fatigued during the day, like you just don't have any energy and you just can't get up and go? This can be a symptom of sleep apnea. Irritability. I know when I don't get a good night's sleep, I'm mildly irritable all day long. When my husband doesn't get a good night's sleep, boy, can he be irritable. And the same with my son. If he doesn't get a good night's sleep, he's just cranky. Just downright cranky. Mood swings. Do you ever feel really happy one minute and then the next minute you're sad, or you just are irritable to the point where you're lashing out at people? This can be a symptom of sleep apnea. Weight gain. Gaining weight because you're not sleeping well at night is a problem. And gaining weight can actually cause sleep apnea. Treatment is self-care. Exercise. Get up and go walk. Walk with me in the mornings that you watch my videos. That's what I'm here for, to motivate and inspire you to get up and go walking. Walk with me. Pop in your headphones and turn on my videos and walk along with me while I walk you through this journey of taking care of yourself. Weight loss. The more you get out there and get moving and walking, go to the gym, do whatever you need to do to take care of yourself, and you will lose the weight. Support care. Continuous pressure, airway pressure. Continuous positive airway pressure, which is also called a CPAP machine. Now, these machines are very funny looking. You ever see anybody when they on TV like Mike and Molly, the TV show. I don't know if you remember it or if you've even seen it, where he wakes up in the middle of the night and sits up and he looks like Darth Vader. He's got this full face gear on his face, and it's a mask, and it's hooked up to a machine, and it's got a tubing that goes from the mask to the machine, and the machine's very silent. What it is it continually puts pressure. They program it for your self-care, for your needs of pressure. My husband's is set in 11 and my son's is set in 8. It's a continual amount of pressure that comes through the mask that keeps your airway open and helps you breathe through the night. Airway management. This is making sure your airway is clear, making sure that you can breathe, making sure that the CPAP machine is working correctly. Take care of the CPAP machine. Keep those masks washed out. You're supposed to wash out your mask every week, or every week to every 30 days, depending on how dirty it gets. I know my son's gets really dirty because sometimes he snots in them, and this is really gross because I'm the one that ends up cleaning it for him. So get in there and clean your CPAP machine. Or some people may be on what's called a BiPAP machine, which is pretty much the same thing as a CPAP machine. I'm not exactly sure what the BiPAP stands for because I couldn't find it in my research. But I know my mom is on a BiPAP machine and my husband is on a CPAP machine along with my son. And I'm supposed to be on a CPAP machine, but my setting is so low, it doesn't matter if I use mine or not, really. It was more just for airway maintenance, airway management. Surgery. Now, this can be scary for some people. Some people don't like going underneath the knife. Some people don't like the idea of surgery, but sometimes if you have a tonsillectomy, it can help your sleep apnea. If you have your adenoids removed, that can help your sleep apnea. I know my oldest son, had his tonsils removed and his adenoids removed, and he used to snort, but it wasn't that bad. I mean, it wasn't CPAP worthy. It was just slightly snoring. But once he got those removed, the snoring stopped, and it really helped him. That, and it keeps you from getting like strep throat if you're tend to get strep throat a lot, or sore throats, and it really helps. Palatoplasty. That I'm not sure what that means. If anybody knows what that means, can you leave it in the comments below? I would really appreciate it. And there's going to be another word down here that I'm going to struggle with, so just bear with me. Now, there's different specialists that you can see. There's a pulmonologist, which treats respiratory tract diseases. There's sleep medicine specialist, treats sleep medicine and disturbances and disorders. My biological father was a trained sleep specialist. He would do CPAP machine management, and he would also do sleep studies. And that's what a sleep medicine doctor does, or sleep studies. And now, to bear with me here, otolaryngologist, which is basically an ear, nose, and throat doctor, which I know there's another term for them, but this is the term that the Mayo Clinic threw out at me. Ear, nose, and throat doctor will actually check to see if your tonsils and if your adenoids need to be removed, and they will work really hard with trying to figure out if there's any other obstructions that may be causing your sleep apnea. Primary care provider, or your PCP, he prevents, diagnoses, and treats disorders. If you fear that you may have sleep apnea, the first call you should make should be to your primary care provider. If anything that I ever talk about in these videos you wonder about, the first thing you should do is call your primary care provider to see if you may have these disorders. Now, I don't want to turn anybody into a hypochondriac. That's not my purpose here. My purpose is to educate and motivate and inspire. But these are the things that those of us that need to lose weight have to deal with. And I'm just trying to get you to be self-aware and to help you take self-care. And respiratory therapist, that's what my biological father was a respiratory therapist. And their job is to treat and provide emergency care for patients who have trouble breathing. My son, my youngest son, when he was little, had RSV twice. And the doctors that came in to treat him were respiratory therapists. And they would come in and do nebulizer treatments on him. They would check to see if he needed oxygen. Respiratory therapists not only do nebulizer treatments, they also help teaching people on inhaler use. They hook them up to oxygen. They do sleep studies. They do a whole wide amount of work. And people think that they do just one thing, which is come in and check to see how you're breathing. No, there's a whole wide circle and a whole wide net of things that they do. Now, I want you to keep in mind that sleep apnea can be very difficult to live with, but you can be treated. And the best thing for you to do is to call your primary care. What's the number one thing I want you to learn here today? Call your primary care provider if you have concerns. That's what you need to be doing. So if you fear that you may have sleep apnea, call your primary care provider. Call them up and say, hey, I was watching a YouTube video, or I was reading over some material. Actually, before you call the primary care, do some research. Don't just listen to me, do your research. Go online, Google Mayo Clinic. Don't Google WebMD so much, because WebMD is kind of like the crackpot diagnosis for online things. Everybody goes to WebMD, though they do have medical dictionaries there that can actually help you out, but make sure that you do your research. Go call your primary care and say, hey, I was doing some research and I think that I might have sleep apnea. Can I come in and sit down and talk with you to discuss my thoughts and concerns on this? No primary care provider should turn you down and say, nope, sorry, we're not going to see you for that. No primary care doctor is going to say that. They're going to say, yeah, let's make you an appointment. Let's have you come in and let's sit you down and discuss your concerns. That's what your primary care doctor is for. If you know of any other doctors that you could talk to, or if you already see some of the specialists and you've got concerns about sleep apnea, bring it up to them. If you see an ear, nose, and throat specialist, say, I kind of worry that I might have sleep apnea. Can we discuss the different symptoms or things that I feel that are coming on within me? And they'll sit down with you and they'll discuss this with you. So basically, what I want you to do is take care of yourself. Learn self-management. You care. And I love all of my followers. And if you liked my video, hit the like button. If you disliked it, hit the dislike button. You're not going to hurt my feelings. If you have any questions or comments, or if there's anything else that you want me to cover, put them down in the comments. I'll do my research. I'll bring them up. I'll do a video based on what you're concerned about. I have no problems doing that. Like I said yesterday, these are things that can cause you issues with trying to lose weight. And I don't want anybody to feel like they can't do it because they may have any underlying issues going on that could cause them from losing weight. Boy, am I getting winded. Been walking too fast or something. So on a side note, yesterday I did my video on fibromyalgia, and I noticed half of my filming was done from a lower angle so you could look straight up my face, and I must apologize for that. I am so sorry. I didn't mean to get all of my camera angles going up my nose. I saw that when I was reviewing it after I had already uploaded it yesterday, and I was so embarrassed and so ashamed. I hope you were able to hear my message, though, about fibromyalgia, and I hope you were able to sit down and think about what I was saying. As far as my makeup, I want to do a shout out to Crystal McKenna. Thank you so much for your compliment on my makeup. I know I don't wear makeup as often as I should, and I plan on wearing it more often. I've been watching makeup tutorial videos that's also been mixed up with true crime, so shout out to Bailey Sarian. I've been watching her videos a lot where she shows how she does her makeup techniques, and I think I've picked up a couple of her techniques. I hope so, because she rocks her makeup styles. And I don't know, I'm not saying I want to be like her, but I think that her makeup style is fabulous, and if I could even do anything half as good as what she does, that would be great. She just does an amazing job. If any of my viewers like true crime and like makeup, be sure to go watch Bailey Sarian. That's Sarian on YouTube. Just search her name and you can watch her Murder, Mystery, and Makeup Mondays. And she does a really good job, very thorough research on her true crime videos, and she does an amazing job applying her makeup. Also, if you like watching true crime videos, check out Kendall Rae, that's R-A-E, where she also does really good videos on true crime, missing persons, conspiracy theories, stuff like that. These two are the ones that I watch and listen to the most. There are a couple other, but I don't really invest my time in them as much as I do with the other two. I think I've watched one of Bailey Sarian's videos. What I do is when I go to sleep at night, I put it on YouTube videos, and I need that noise to help me sleep at night. So I'll prop it up against my chest and I'll listen to YouTube videos, and Bailey Sarian's the one that I always pick, and I must have heard her Death by Chocolate video probably a good 50 times now, but it's a really good video. If you like true crime, check those out. I plan on doing true crime segments. I haven't got started on my research yet though, but they're not going to be like grisly true crime segments. It's more going to be funny, dumb criminals. Like, have you heard about the guy who decided to break into a lady's second-story house and fell through a skylight that was on the first story and landed on her cutting board where there was a knife, and he ended up getting stabbed Yeah, true story. Happened in Florida. Landed on a knife, got stabbed, called 911. 911 showed up at her house, woke her up in the middle of the night because the breaking through the skylight didn't. They took him out. He sued her, and he actually won. Can you believe that? He breaks into her house, and he sues her, and he wins. So she ended up having to pay him restitution for his injuries from him landing on this said knife that was on her own cutting board in her own house. And the judge felt that she should have been more careful with the knife, I guess. So we're going to do more dumb criminal videos like that. I've just got to be able to sit down and do my research. It's kind of hard doing that during the day because I've got my son and I've got a house to maintain, but I will get down to doing that. I would like more followers, so if you could share and ask them to subscribe, that would be fantabulous. I love my subscribers that I already have. I think you're wonderful people. And I will see you tomorrow. I'm going to leave tomorrow's video a mystery because it's probably going to be something that bothers me about me. So let's just wait until tomorrow and see what I have to say. So I will see you tomorrow. Love you, my beautiful people. Bye.